been through this one before. I'm Naylor. I'm one of the clinical system specialists from NECS. We've been doing a couple of sessions recently with the GP task force in Derbyshire for GP sort of practice managers and systems admin kind of staff on some of the cleverer bits, I suppose, the clinical systems. So today we're going to talk about auto consultations and views in SystmOne. Both of these sometimes get known under different names. Auto consultations, you sometimes hear people refer to them as macros or things like that. And views, you see them in a couple of places as, you know, summaries, that kind of thing. If you've ever seen the quick glance node of SystmOne, you've seen a view. But we're going to talk about some of the clever uses for them and some of the other places that you might use them beyond doing the traditional home visits view that a lot of practices will build when they first go on, for example. So we've said mute microphones if possible, just to get feedback. If you need to ask me anything, stick it in the chat. I've got that open on the screen so I can keep an eye on it. If it looks like I'm ignoring you, I'm not. I'm just trying to sort of hit the end of the point I'm making before I address it. Just helps me keep my train of thought. Said camera ready. I actually suggest everyone keeps their cameras off because it just makes everything grind to a halt. You don't need to see me. It'll be far more useful if you see SystmOne anyway. And as I say, questions, etc., comments in the chat, I can keep an eye on that. We'll probably have a bit of time at the end to go over any questions. What I will do today is I'm going to break this in half. We're covering two bits of the clinical system. So we've got auto consultations and we've got views. So I'll try and stick a bit of a breather in if we think we need it, just 5 minutes at the end of auto consultations, and we'll sort of address any burning questions there before we move on to views. And then obviously if we can also save some to the end if they're a bit longer. So that's the end of the death by PowerPoint. I'm sure everyone will be pleased to know. We're going to swap to SystmOne instead. It's a demo unit. So as usual, anything you see in here, it's not real patient data. We're not going to get in any trouble for what we show on here. We are just going to be looking at a demo unit. So we'll start with auto consultations. Now, you probably, asterisk in front of that, like with most things in the clinical systems, you'll probably have seen these before. And they get used for a variety of things, but most commonly, they'll get used to add one single piece of information over and over again to a record to save somebody adding it all manually and taking ages to do it. A really nice example that I like to use is the safety netting advice that a GP might give. You know, the usual kind of contact if worsening, 111 out of hours, that kind of little blurb that quite often gets put at the end of a consultation. Well, rather than type that out 40, 50 times a day, it's quite handy to have an auto consultation. You click a box on SystmOne and it sticks it on the record for you. Auto consultations can be quite clever. We can actually add quite a lot of information through these. They quite often get overlooked in favour of templates and protocols. Templates because they're so much more interactive. You can see all the information, you can pick and choose what you put on. And protocols because they have that sort of more decision-making element. You can be dynamic and respond to questions and go down a particular path. But auto consultations definitely do have a bit of a niche. I'm going to give you a couple of examples, one of which is quite a nice way of showing what it can do, but it's not one that I'd particularly try and do in the real world. Okay, so for those that have been on SystmOne a while, probably 2 or 3 years ago, I'd imagine, you might have looked for auto consultations, having used them before, and found that they moved. A couple of years ago, they moved into setup, workflow support, and automatic consultations. Off the top of my head, they used to sit in data entry, but it's been that long, I've forgotten now. So setup, workflow support, automatic consultations, and you will need the template manager access right to be able to get to these. Give SystmOne a second to open up. Okay, so first one I'm going to do is that really basic one, and it's, you know, not in any way clinically assured. I am not of a clinical background. I haven't got the foggiest what I'm talking about when it comes to the human body. We're going to make this up a little bit, but just that example that I used at the start. We're going to do a new auto consultation from the new button here. Categories, work the same way as everything else in SystmOne. These are your folders. For now, let's stick it in the GP category. If we wanted to create a new one, we create a new category here and give it a name. It gives it a new folder. And we're just going to call this safety netting. We can pick an icon, as with everything else in SystmOne. This is the bit that takes longer than everything else. No reason for picking that icon, it's just the first one I saw. And we can put a description if we want to explain to the user where something is intended to be used. With auto consultations, we can put a gender and an age criteria on them. So we could say, for example, that it's not possible to use a smear auto consultation on a patient we call as male. We could say that it's not possible to use an over 65 flu jab auto consultation, someone who's 64 or under. They're very black and white. I say this every time these come up. So if there's a chance that you'll use this on somebody in the other bracket, don't put a condition on because it simply won't show up as available to use on them. Safety netting obviously can apply to everyone, so we're going to leave that open, probably on male and female patients of any age. What we do then is we tell our auto consultation what type of data we want to add. And in this circumstance, we actually want to add a little block of free text. So here we want to add a note. When I've chosen the data, I click Add Data to the right. And I tell it what I want it to add to the record. Now, like I say, this isn't what I would suggest that your GPs write. This isn't assured in any way at all. It's just a demo. So let's go. Okay, worsening. 111 out of hours. A&E. Let's come back to practice if no improvement. Okay, not very creative, but that will do as an example. We then, with most of our fields, there are a couple of exceptions, we'll talk about them in a second. With most of our fields, we tell them which part of a consultation we'd actually want these to drop into. Safety netting is kind of part of my plan, really. It's what we're going to do next or what we're looking out for next. So if I say OK, we've only got one piece of data on this one, and that will be fine for the purpose of this. We're going to get a bit more creative in a second. We can link a view to an auto consultation. Slightly back to front for our training session today, but we can link the things that we're going to look at building a little bit later to our auto consultation. Now, in this circumstance, I don't think it's going to be particularly useful. But if our auto consultation was to launch diabetes review template, for example, we could show their recent reviews, for example, as a view. An event details template, we're not going to go into these in great detail today. We'll probably talk about these in a future session when we do some clinical templates. An event details template basically says that this thing happened in a certain way at a certain place with a certain person doing it. As an example, if we were building an automatic consultation for under 65s flu jabs being given by another provider, so where we get letters, for example, to tell us that it's happened, we could create an event details template from the new template button to say that instead of being me and here, that event was done by unknown at a different location. So we could find something like staff location. I won't go trawling through here too much, but there's probably a community pharmacy somewhere in there. But it will still be clinically relevant. And what that basically would do is every time somebody used the auto consultation, it would change the event details, the who, what, where, how, to the event details template that we'd set. Not going to dwell on it too much today, especially for this one, because it's not particularly useful. So that's all there is to building one. Very simple, and we're going to look at a more complex one in a couple of minutes. We click OK. We don't have to publish these. So if I go into GP, it's already there. And now if I hop into one of my made up patients, we can have a look at how we actually use them. I'll put my pretend GP hat on for a moment here. And let's put, sorry, that's been playing with the old style consultations. Let's go. Sore throat, 3 days. Etc, etc. You know where I'm going with this one. Now we do all the, the examination, temperature, have a look in the throat, glands, etc. Diagnose it, maybe it's tonsillitis, we might do some medication, we come down to the plan. We don't want to have to type all that stuff that I've just typed up about going to A&E or 111 if it worsens or coming back to the practice, etc. We want our auto consultation to put that all on for us. Several ways we can add these. Probably the two most common are the auto consultation button up here at the top, which lets us pick from categories. If I click our auto consultation, it just adds that little block of text that we set up to the field that we told it to go into, so the plan part of the new consultation. Alternatively, you'll find that some people will use the F12 launcher. So if I type safety netting, let's put it under S because that's what it starts with, you'll find that some GPs, nurses, etc. will hit F12 and pick it up from their launcher instead, a bit like a speed dial. Now the beauty of these is that we can change what it puts on. So if I've said to the patient, actually, don't want you to come back in 2 weeks if it gets worse, let's give it 4 weeks. That's just a block of text, so I can edit it live. Okay, so that's a really basic auto consultation. Now we're going to get a little bit more clever. We're going to add a few different types of information in one go. And we're going to go back to our auto consultations. So set up workflow support auto consultations if we're looking for them. And we're going to say no. This time, we're going to do one that I wouldn't really encourage in the real world, but it's a good example to demo with. Let's do a tonsillitis one, and you'll see why I wouldn't recommend it in a second. So this time, we're actually going to try and get SystmOne to build up most of the consultation for us. So let's go for, let's put a note on first. Let's say sore throat, blank days, nausea, fever, yes, not that, fever and flu. Again, not clinically warranted by any way, shape or form, but gives a nice example. I might want to stick that in the history, what the patient's reported to us. We then might want a diagnosis to go on. So we've already looked at the patient and said, yeah, we think it's tonsillitis. We might want to add a read-coded diagnosis. So from our drop-down, add data, search for a code. Let's go for, let's go just acute tonsillitis. We could add notes to that code as well. I'm not going to in this circumstance. And we tell it which section we want to drop it into. Let's go diagnosis for this one. We might then want to, and again, clinically, no idea if this is correct, it probably isn't. We might want to add a medication. So we're going to add an acute medication from our data to insert. Add data. When it wakes up, let's see if we can stick some amoxicillin on. Usual prescribing setup. And we might want to add a plan. So we'll put another note on, down at the bottom, of see in 2 weeks if no better. what we've done there is basically pre-formulated the consultation. So we've put something in pretty much all the fields that we'll get in a normal consultation. We obviously haven't done the observations. We've not tried to put any codes on for temperature or, you know, pulse rate or SATs or that kind of thing, because that would be too bespoke to the circumstance. But say okay at the bottom like we did before. Let's hop back into my made up person. And this time, GPs call the patient in the start of the consultation. They go straight to their auto consultation for tonsillitis. And you can see there it's already started adding things, and it's actually got to the point of asking us about adding the medication. So that's basically just you can see a record somewhere else. So it's populated all the information we just set, and it's dropped it into the fields that we told it to drop it into. So then as my GP, I can drop in, yeah, sore throat 5 days, nausea, yeah, fine, fever, yeah, they're very hot. And some old style notes here, spots on tonsils. I can still drop in my temperature, let's go 38, pulse. Again, clinically rubbish, I'm sure, but it'll do. All stuff you guys have seen before. So you hopefully can see here that the auto consultation doesn't have to be the whole thing, but it can fill out bits for us that we can then add to. It can pre-populate bits of the consultation, particularly where there'd be a lot of typing. Fairly basic thing, but like I said, with the safety netting, it's just something that our GP hasn't got to do 50 times a day. You see there, it's prescribed the medication for us, so it's geared that up ready to print or send electronically. It's added the diagnosis, it's added our plan. We can still delete bits, I can still change bits that were part of the auto consultation. Save our record, and there's our medication. I'm just going to say do not print for now, because I haven't got a printer, but that would be our script for amoxicillin. Okay, now, bit of an error caution before we move on. I wouldn't personally be looking at trying to do too many auto consultations for common consultations. Reason being, obviously, is that things are so subjective. As you saw there, I just went with the options that are available. There's that trade-off between spending more time actually deleting and changing than you would do if you just typed it from scratch. So while they're very useful for that, I wouldn't go too overboard with trying to do whole consultations for auto consultations. Far better for adding parts of them, safety netting, etc., that you want to add routinely, and they're almost always in the same format. You might tweak 1 or 2 words at a push. They're also quite useful, and you've probably seen this on your own systems, for things that are done basically the same way every single time. So there's one that I would imagine most of the practices in Derby will have on their system, which is an auto consultation to prescribe anticipatory meds for a syringe driver. Now again, not a clinician, not a pharmacist, don't work for meds management. I think I can remember them. I'm going to make this up off the top of my head, so don't start sort of hammering me in the chat to say that all of my meds are wrong doses, and I'm going to, you know, blow the patient up or something like that. This is just illustrative. But let's put this into a new category. Let's call it medication. And we'll call this one anticipatory meds. Again, not being creative with the icons at the moment. And this time, I might just want to add 5 acute medications. So I've got to remember. So, and again, I might be picking the wrong ones here because I am not a clinician. But just for illustrative purposes, we've added 1. We can go for another one. So this standard prescribing dialogue, what we're basically doing here is pre-setting the prescription, and you'll see what happens in a second. Don't judge me here. It's a long time, mercifully, since I've seen anything to do with these, but I think, yeah. For illustrative purposes it'll work. We've got 5 medications there. We've set the prescribing, so we'll set things like the dose, the quantity, the duration in exactly the same way we would do prescribing a new acute medication. But what's going to happen when I go into my made up person and choose that auto consultation, so we put that in medication, it's basically going to tell me, as it does with everything on this patient, that there's a bit of the record somewhere else because he's on a demo unit. But it's going to walk me through basically doing each of those 5 meds. It's giving me any warnings for each of them, adds them all as acute meds. They go into medication, they're all sat there on today's date, and it gears them up ready to print them off. So essentially, where those medications aren't going to vary from patient to patient, or at least not, typically, it saves my clinician having to do what I've just done. Remember which ones they use, in which dosage, which combination, which version, which formula they're supposed to use for it. And instead they just pick the anticipatory drugs. It fires all 5 of them through, and in the real world that would give them a script that could be sent off to aseptics or wherever it goes now. Okay. The other thing we can get auto consultations to do is actually launch another piece of SystmOne. Now it's not quite as freeform as the quick action button on templates. It's not quite as dynamic as protocols, but it does have a bit of a niche. We could do a new one, let's say. I'm not sure what templates we've got, but we'll play with it here. Or just give it a name test for now, just so I can show you what it does. We'll give it an icon again, not being creative here. We could tell our auto consultation to launch a template for us instead. So it might be, tell you what, let's do a quaff one. We'll do the diabetes quaff template. So let's call this. Okay. So we've told it to launch our template. So for the person that's actually doing the diabetes review, they're going to fill that one in as they would do normally to get us the quaff points. But we then might say at the same time, we want a recall adding in the background. Let's go. I don't know if we'll have one on here because demo unit. Let's go diabetes annual review. Pending status in 12 months. So what's going to happen now? They're going to open the auto consultation, fill the template in the background. It's going to add a recall to bring that patient back in 12 months' time. We could also say we want a task to go to, let's say we've got a diabetes coordinators or something like that in here, or long-term condition coordinators. Let's call it administration. Depends on your local process, obviously. And that will do for now. We've obviously got the elements of the consultation that we talked about before. We've got the option to launch questionnaires if you use them at your practice in the same way that we've just done the template. We also have the option to record a vaccination, a consent or refusal from here. But let's have a look at this one. So now if I go into my made up person, and auto consultations, I can put it in GPs, diabetes review. It's going to do 3 things. For me, it's going to bring up the diabetes cough template. So I'm going to work my way through, filling this in. Okay. In the background, you can see there, it's added a 12-month diabetes annual review recall. And if I click save, it will have launched across to the NECS trainers, which I think I'm part of, maybe not. Let's go assign to groups. There we go. There's the task that we told it to set up. You'll find that kind of thing is quite often done with protocols in practice, just because they'll be used to using them for other things as well. But where there isn't an element of decision making, or there isn't an element of variation depending on the responses that somebody gives to triggers, auto consultations can actually be quite a nice way to automate a process. You've probably noticed that your options are quite limited compared to a protocol. You can't get it to anything in SystmOne. You can't get it to, I don't know, create a letter or print a form or something like that when you add something in the same way that you can with protocols. But if the options meet with your local process, they can be quite a quick way, quite a neat way to apply blocks of data or several different actions to the record in one go. Okay. So, a couple of fairly quick examples there. As I say, I tend to go away with auto consultations from anything where there's going to be much variation at user level. I wouldn't set one up like I did with the tonsillitis one that's going to try and preempt an acute consultation, because there's too much variation in it. But they can be really quite handy, like with the diabetes annual review, where you maybe want to add a code, a recall, a task, and then have a user fill out a template while all that's happening in the background. I'm going to pause for 5 minutes and I'm going to open the floor to you guys. So you're welcome to unmute and ask questions, or if you haven't got microphones, I can see the chat as well. Is there anything that you'd like to ask about auto consultations, or is there anything that you'd like maybe to have a look at, you know, could we do an auto consultation for something, or how would we go about ... Over to you for a couple of minutes. On the Western Front, I'll take that as a good sign. Obviously, we're not going anywhere, so if there are questions as we go through the next section, you're welcome to bring those up as well, and we can also look at any at the end if any inspiration strikes as we're working through views. Before we move on, I'll just mention quickly, same folder, set up workflow support, automatic consultations. This is where we go to manage our auto consultations. We can, as you would imagine, amend them by highlighting and clicking amend or right clicking. We can copy them if 2/3 of it is reusable, but we need to make a particular change. For example, if we wanted to create an under 65 flu auto consultation and then wanted to copy it and just create an over 65s one where we just change the vaccination that's being given, for example. We can import and export from another SystmOne unit. So if you've got a practice down the road that's built loads of these and they work really well, and one of you happens to be over there and sees them working from them and is really impressed, if you ask them nicely, which I'm sure they will, because we're all on the same side, they can export their list of auto consultations and you can import them into your unit with those 2 buttons up at the top. We can delete auto consultations, obviously, and get rid of them fairly permanently. But we've also got the option here, this little checkbox over on the right hand side, to make them inactive or then subsequently make them active. So if we're making a decision on one, we don't really want to be using it at the moment, but we want to keep it around so we can test it, play with it, maybe make it a bit better, then we can make it inactive so users can't find it in their list of auto consultations. It doesn't mean that if we don't then decide to use it, we have to start from scratch. Keeps it there on the unit. Okay, so if there aren't any questions, I'm going to move on to the second half of today, which is something called views. You'll have seen views. I say with a degree of confidence, if you've been using SystmOne for more than about 10 minutes, you will have seen a view somewhere. Let's pick on an example. Let's go into my dummy patient again. And if you've not seen this at any point since you went on to SystmOne, I'll be very surprised. The old quick glance. That's a view. Sometimes gets called a summary. In fact, it gets called a summary in the system. If we go to patient, print summary, we could actually say print view there. And this is where they become quite handy. A couple of places we might use a view, to my mind. We might want something that we can either print out or save as a sort of PDF and email across to somebody. So you'll find quite a lot of practices will have a home visit view, for example, that might highlight to a GP going out any quaff that the patient also needs doing while they're there, or any things that are coming up that they might need to do, injections, that kind of thing. We might have an admission view. So if we're sending a patient to MAU or SAU, we could do a view that will pull through the last consultation, or the one that we're doing at the moment. We'll pull through their current meds, their allergies, their significant medical history, the problems or the summary, that kind of thing. Somebody, the admitting clinician at MAU doesn't really care if that patient's got outstanding quaff or not, but they do need to know if they have an allergy to something they're about to give them, or if they're on a medication that might interact with something they're about to give them. So views do have a use for in that kind of setting where we want basically to collate a lot of information out of the record fairly quickly and put it in this kind of tabular format that we can print out and send to somebody. The other main use that I've found for views, I'm sure there will be others, and if you've got one, again, stick it in the chat because we can explore that as a group. It's the beauty of these sessions. We've got people that are actually using the system in practice on here, so you'll have ideas as well that maybe I'll have forgotten since I ran away from general practice and became a trainer. But the other main use I've found for views is on clinical templates. And if you've been into the quaff templates, you'll have seen this. So if I go into, let's pick on my diabetes one actually, going through my auto consultation, there probably will be, unless they've changed it recently. Typical, that's just to show me up. That's just to show me up. They used to have views on templates as well. So for example, if I was doing a diabetic review, I might want to see their last HbA1c blood result. I might want to see if they've had retinopathy screening recently. I might want to see their last foot check. I might want to see on an asthma patient if they've had any exacerbations in the last year. I might want to see if they've been to A&E or anything like that, without coming out of my template and going trawling through the record to find it. Views basically allow us to be selective in the information we present in those little tables. So how do we make one? I'm going to discard my patient for now. We're going to go to setup. This time we're going to go to data output. Not strictly true, because we can also enter information through a view, and I'll talk about that in a few minutes. But generally speaking, views are used to show information from multiple parts of the patient record in one place. So we're going to go data output, view maintenance. You'll find a great number of system-wide views. You probably will have some organisation-specific ones. You might also have some published to you through various organisation groups. Let's start at the bottom and let's go build ourselves a new view. And we'll build a couple of the examples that I've talked about there. So the first one's going to try and be fairly comprehensive. Let's do a GP home visit view. So what kind of things might my GP benefit from knowing when they go out to see a patient? This is going back a few years to before they all had, laptops and that kind of thing. I'm aging myself here, aren't I? But it still can come in quite handy. So let's go for, they probably will want to know the patient's name and address, particularly if they've got a handful of views to do. So we go here to the left-hand side. These are the elements that we can add to our view. And let's add some patient details. And we'll go patient details without GP details because the GP knows who they are. They then might want to know, or more specifically, practice management might want to know. Your GPs will as well, but you guys know what I'm talking about here. They might want to know if we have any outstanding QOF that we need to look at while we're there. We might want to know if there are any outstanding recalls. All I'm doing here is double clicking on fields, and you see how it's starting to build up a little table. We then might want to know, let's say we're problem based at our practice. So we might want to know, that's where I have to find them, what the patient's major active problems are. Might also want to know what their minor problems are. We might want to know what inactive major problems they have as well, in case something is flared. And we might want to see, I don't know, let's say the last 3 hospital letters, just to see if they've seen a specialist recently. So we could go to our comms and letters. And we're starting to build up a little bundle of information, probably a side of A4 or 2, but that might be quite useful to a GP who's going out to see a patient at home. Now with this, as an example, our GP probably doesn't want all of the patient's communications and letters on their view. They don't want 4 or 5 pages telling them that they went to see an orthopaedic surgeon in 1994. It's not going to really benefit anyone. That will be in their problems if it's significant enough. All of the fields that we add here will have some parameters at least that we can set on them. So let's start with our comms and letters, and we right click on the field. And we're going to specify a filter. Now in this case, I only want to see the last 3 letters that they've had added to the record. So we're going to specify first or last filter, and we'll say the last X, last 3. We can apply multiple filters to a section. So I could say only letters that were, let's try amending it instead. Give me the option on that one, ignore me. We could say only show me letters that have been added in the last 6 months, sorry, 24 weeks. So again, we just right click, specify a date filter. We could specify a location filter. We could say only show me letters that were added here. So either scanned on or done as letters from the practice. Suddenly, what would have been a huge block of information on our view becomes quite a concise one. Separators essentially are titles in our view. They break it up, they separate it in sections, so our GP knows what we're looking at in the part below. Our separator at the moment currently says all communications and letters. Well, that's not what we're showing now. We're actually showing the last 3 letters here in the last 24 weeks. So if I right click on my separator, I can amend it and I can actually change the name. Last 3 letters here. And then 24 weeks. Suddenly, that tells my GP exactly what they're seeing below that separator. We might want, let's say, the patient's last 5 pathology or radiology results as well, just to see if anyone's tested anything on them. So we could go back to our left-hand side. We're still in our core items, essentially patient record. We could say, if I can find it, pathology results, pathology radiology reports. Let's say all plus investigations. But then again, we right click, we specify a first or last filter. We'll go last X, let's say last, let's say last 3, that seems sensible again. We can right click, we can specify a date filter. We don't need a HbA1c from 3 years ago. We only need one if it's been done recently. We might say that's the last 12 months. And again, we're going to amend our separator to say last 3 pathoradiology last 12 months. We don't need an X-ray from 5 years ago, but we might want one from 8 weeks ago. Almost everything that we add to our view will allow us to apply these filters. They'll vary slightly depending on what we're adding. And we're going to have a look at a couple of others. We'll do something slightly different in a second, and we'll try and build an admission view. If I OK that, it's going to shout at me because I've not done an icon yet. Again, not mega creative, we'll just pick the first one. Let's go into my made up patient again. We'll see views in a few places, but if you have a folder on your clinical tree that is topped with quick glance, there's a very good chance that all of your views in the practice will sit in that folder. Hopefully you can see here I've expanded it, and we've got some way down the list our GP home visit. So that's the view we've just put together. Patient details, who they are, where they live, etc. Quaff alerts, because we want to capture those while we're out. Outstanding recalls, you know, if the patient needs a Zolodex doing while the GP's out there, it makes sense to try and get that sorted as well. Major active problems, minor problems, inactive problems. It's not showing us anything because the patient doesn't have any. Last 3 letters here, well, he's only had 1. Last 3 pathology results, well, he hasn't had any, so there's nothing to show us. Views, like I say, we can put them on our clinical tree. We can actually. If I go, I don't think we can. We'd have to put it into an auto consultation. Ignore me, thinking out loud there. We can add them to our tree. We can pick them up from patient print summary if we need to. GP home visit one's there. We can add them as quick actions, etc. We'll do another one on a similar footing, but we'll tweak our options slightly. So if I do set up data output, view maintenance, we're going to go to do a new view. Usual options apply, by the way, same as we discussed on auto consultations. We can amend, we can copy an existing one if we want to make a couple of tweaks, we can publish to a wider group, we can delete entirely, we can import and export from a different SystmOne unit. We can upload a view to the resource library, do with caution obviously, because that makes it available to all users on SystmOne if they download it. So while the burden of assurance is on them, it still makes what you've created available across the clinical system. Basically, it makes it available for download. And we can, as we said with auto consultations, we can make a view active or inactive. So if we don't want to delete it entirely, but we don't want it being used at the moment, we've got the option to do that. What we're going to do is we're going to do a new view. And this one's going to be called acute admission. We're going to go back into our core items. I would venture, a bit brave, but there you go, 90% of the time, you'll pick things from your core items to go onto a view. These are basically elements of the patient record. So the first one we're going to do is a patient details one. This time, because we're admitting them, we'll just go patient details because we want the GP part in there as well. We want the admitting clinician to know where they've come from, basically. We will probably not bother with our quaff and recall at that point because our admitting consultant isn't about to do their diabetes review when they get there. So for that, we'd probably start with a bit of sensitivities and allergies. And let's go for the sensitivity and allergy summary. Let's go for both, so recoded allergies and drug allergies. We'd probably then want to know what medication our patients on. So let's go for their repeat templates. We can say show their current repeats. We could say medication, primary care, because it's things that we've done. And we could say current acutes. We could say all acutes, but obviously, if we say all acutes, we're going to have to start applying those filters again. We'd have to right click and amend. We might say, let's do it while we're here, all acutes, but we might actually specify a date filter. Again, 24 weeks, 6 months. Sound sensible? Let's amend our separator. So it actually says what it's now showing. All acute meds last 6 months. We might want to show problems again, so significant medical history. So let's have the active major, the active minor, and an active major. We might want to try and grab the last consultation that we've done. So if I go to my, still in my core items, I'm looking for the journal in this case. And let's go for, sorry, new journal. There we go. He says, no, I'm not. Thursday afternoon brain here. Let's go for journal or, and change to last one. There we go. So we're going to get the last event basically that was added to the journal. We'll amend our separator again and say have to select an icon. You'll get very used to seeing that pop up because you will forget. And if we hop into our patient again, we should, if I discard him and go back in actually, because it needs to show the view. Just give it a second to wake up. There we go. So if we go to acute admission, double click, opens in a separate window. Patient details, but this time we've got the GP part because we chose that field. Sensitivity analysis summary, so everything that's currently on. Drugs and other. Current repeats. Acute meds issued in the last 6 months. So you can see the drugs that we added as part of our auto consultations, the amoxicillin and the anticipatories there. Major, minor and inactive problems. And you can see the last event that we did where we didn't actually enter any information, we just went into the record and saved. We can pull through the last thing that happened. And obviously you can get quite creative with that one. Again, using those filters on the right click option, specify who did it, what kind of person did it, clinical practitioner, nurse access, etc. So you can start to filter out the admin stuff. Okay. So they're all well and good views when we're sending somebody somewhere. If we need to pull bits from all over the record fairly quickly onto a single side of A4 or 2 sides of A4 to send with them. But sometimes we might just want to show somebody a snapshot of information while they're in a different screen in the clinical system. I'm quite a big fan, and this is a little bit subjective. I quite like views as an item on clinical templates. So if I'm doing a meds review template, I might put a view into the template. It's a field which we'll look at when we do clinical templates. But we might create a view for our meds review. Let's come out of our patient and create a new view. So set up, data output, view maintenance. New view, we might just call this one current medication. And from our core items, because it's part of the patient record, we can go repeat templates, and we'll go current, and we'll go medication, and we'll go current accused. So if I'm reviewing their meds, I don't want to be necessarily hopping backwards and forwards into the repeat templates part of SystmOne. I could just embed a view in my template that just shows me the patient's current acute and repeat meds. Save me coming out to go into a different part of the system. Like say for my diabetes review, I might have a view on my template that shows me the patient's last 5 HbA1c results or last retinopathy results. Okay. What we can also add to views, let's start to get a little bit more creative. Let's add I don't know if we'll have one on here, but let's say as part of our current medication view, we also wanted somebody to fill out a template or to be able to access a template. Down here at the bottom, we've got the option for old style templates, which we won't use many of now, and new templates, so we can show recordings of. Let's go for recordings to template, and let's say this is I don't think we'll have a meds review, but I'll check. Medication review, that'll do. The icon again, let's go to the green one this time. So what we're telling it here, as well as showing us the current and acute and repeat medication, we're showing it actually, show me last time information was recorded in that data entry template. So we're effectively looking at the last review without having to come out and go somewhere else in the record to see it. Without having to add all the fields from the template to separate ones. You know, we could obviously go through show all readings of code from core items. We could go show data of last review, that kind of thing. We don't need to. We want everything that was recorded on that clinical template to show on our view. And like everything else, we can right click and we can specify. So we could say, actually, just show me the last entry that was made in that template. Let's have a look at a couple of the other bits that we can add to views. So down here at the bottom, as well as pulling information from the template, we can add utilities. So you can see there we've got a current medication summary as a pre-built for us that we can just drop on. This repeat template review, exactly what it sounds like. We can show everything recorded today. That's really quite a nice one when we do talk about the admission one, and it's another way of doing that journal side of things. We can say, instead of specifying a particular entry, just pull everything that was added to the record today onto a page, so your GP doesn't want to type out the consultation again into a referral letter. They can just pull entries that have been made straight through onto the view. We can also show other views in a view. We get a bit of inception with that. We can add separators, so we can actually add our own. They come when we add an item, it attaches a separator with it. But if we accidentally deleted that, we can then hop in and add our own. So let's separate, and we can move it up and down with the little arrows here to the left of the box. And finally, last but not least, we can add a configurable toolbar to our views. Now this, not wildly dissimilar to our configurable toolbar that we get at the top of SystmOne. Let's say, for example, at the top of this, I want to add a button to do the medication review template. We'll move that up to the top of my view, and we'll delete the separator for configurable toolbar. We'll click OK. Name I'm using it. That'll do. Keeps it out of the way. Let's hop back into my made up patient. And again, it's in my folder on my tree because I've just got a folder with all the views of the unit on. Current medication, stuck my name on the end of it. Doesn't look wildly different to a normal view, except for the fact that we've got this little button up here. Like I say, awful lot like our toolbar in SystmOne. Basically means that from the view, we can tell somebody to fill the template in. We can also then, as we said, pull through previous entries from a particular template into our view without having to specify the fields individually. Okay. A little bit of a whistle-stop tour, most of these things are. I'm hoping, if nothing else, they start to spark some ideas, get you looking at ways that you can use the system to make life a bit easier, and obviously then come back to us if you need any help setting up the specifics, or if you get stuck with what we've looked at today. Again, I'll take a little breather. I'll open the floor up to you guys to see if there are any questions or any examples that you'd like to play through live. If there's a particular view or a particular auto consultation that you've been thinking about attempting in practice, I'm quite happy to have a go at it on our demo unit with you now. I want to demo. It's a little bit more difficult on the demo unit because obviously the data isn't as well maintained. But one of the things you can do with views, if I go back into my setup, data output, view maintenance, let's pick on my what should we go for? Let's pick on asthma events. For no other reason than it's the first one I saw. One of the things that we can do for elements within a view is specify a report filter. So while we can tell SystmOne to work from the basics, you know, show me the last 5 of this thing, show me the last time this was entered if it was in the last 6 months, we can also use clinical reports to tell SystmOne whether or not something should show on a view. So we could say, for example, if we were doing a home visit view, that our recent pathology results only show for certain types of patients. We might say they only show for patients that have got long-term condition, or they might only show for patients that haven't been admitted to hospital in the last 6 months. We'd obviously have to build a clinical report first, but we can tell SystmOne to only show a field if the patient appears on a particular report. Mute myself again in case anyone gets a flash of inspiration, wants to have a look at anything particularly with me, or ask any questions about what we've looked at today. Okay, so I'm taking no questions is a good thing. I appreciate, again, like with most of these, there's quite a lot taken in one go. The session has been recorded, so you'll be able to go back to it for reference later on. You can always, of course, come directly to us as well through the NECS help desk. So if there's something we've looked at today that you're particularly interested in, you can stick a call through to us through the help desk number, 0300 555 0340. You can use the email or the self-service portal as well. If it's a fairly quick question, so I'm trying to add a particular thing to my view and I can't find it, I'm trying to add this field to an auto consultation, but it doesn't seem to exist, we'll be able to remote on and help you with that. If it's a bit of a broader question, can you help me build this from scratch? Can you look at ways that we can try and do this? Obviously, then we can look to book some time with you to go one-on-one and actually play through an example that you've got in mind. But hopefully what we've looked at today will at least spark a couple of cogs whirring, spark a little bit of inspiration, look at a couple of ways that you can minimize the amount of trawling around the system you have to do, minimize the amount of clicks that you maybe have to do, or the amount of typing that your clinicians have to do for the stuff that they add to a record dozens of times a day. So unless there are any questions, I'll say thank you very much, guys, for joining us. I hope it's been useful. My colleagues at the GP Task Force, they've been keen to emphasise they are keen to get feedback on these. So first time we've really done sessions like these together. They seem to be going down quite well, but obviously you guys tell us how we can make them better. Tell us any topic areas that you'd like us to cover in the future. and we can have a chat about whether that's something we can do. Otherwise, have a good rest of the week.